Hello everyone, hope you're having a great night tonight, and thank you for taking the time to join me for this short webinar. So, I'm just going to be answering the question today, are custom foot orthotics right for you? So I'm very excited to share this opportunity with you today, as I have seen orthotics make a huge difference in many of my clients' lives. So my hope for this presentation is to help two different types of people. For those of you who are dealing with pain currently, I'd like to show you how corrective foot orthotics can make all the difference in helping you get back to walking confidently again. And for those of you who are looking to prevent future dysfunction, I'd also like to show you how corrective foot orthotics can help you stay pain-free. So let's get right into the rest of the presentation. So I have two goals for this webinar. I'm going to cover these two main topics. So I'm going to show you how custom foot orthotics can reduce pain and help you move better. And I am going to explain how we design custom foot orthotics that address your needs and perfectly fit you. So first of all, let's talk about who we are. So my name is Taylor Romanchuk, and I completed my kinesiology degree at UBCO in Kelowna, and I just moved to North Vancouver at the beginning of this year. I'm a registered kinesiologist, and I run Rejuv Medical Fitness here in North Van. And I help people exercise and improve their health who have all sorts of injuries and health conditions. I'm actually certified with the Functional Aging Institute, and I've specialized in working with people of a more advanced age. But I also have an extensive background in martial arts, so I'm comfortable working with people of all ages. So an interesting thing about me is that I have always been super passionate about fitness, as I started martial arts when I was just 4 years old, and I have continued with it for well over 20 years now. So I hope I can share that passion for fitness and health with you today. The man next to me is Dr. Naran, who I'm sure most of you know. I work alongside him in North Vancouver here. He is a physician and specializes in treating muscular pain with trigger point injections and laser acupuncture. So Dr. Naran and I noticed a trend of patients coming in who are using either low-quality generic inserts or old worn-out orthotics that were not adequately supporting their feet anymore. And we were tired of seeing this, so this led us to start offering high-quality custom foot orthotics with FootMax. And we have collaborated extensively to bring you this exciting opportunity today. And we genuinely believe this can help you move and feel better. So let's start off with what causes foot problems. Well, with the foot always in motion and under pressure, it's only natural that problems can develop in the feet. I've listed some of the many causes of foot dysfunction here, but lots of them seem to boil down to repetitive overuse injuries. So for example, a common activity that can cause injury is long-distance jogging with flat feet or having a muscle weakness. And I know many of you out there probably enjoy jogging, but you will eventually run into dysfunction if you continue on without addressing these problems. Here's another interesting little fact. It's actually estimated that nearly 75% of the general population is suffering from overpronation, which is basically when your foot rolls too far in one direction. While you may not feel pain yet from that, in a number of years you likely will, and it will start to become more and more of a problem. Also, ill-fitting footwear can also lead to foot dysfunction. When we wear improper shoes, it can cause abnormalities in our foot function, which can have a huge impact on our entire body, causing pain and discomfort in other areas as well. In some cases, foot ailments can be the early sign of more serious medical problems like arthritis or diabetes. So while you may find a pair of cool or cute-looking shoes, how it fits and supports your feet should always be the first consideration. So moving on, let's dive into what orthotics actually are. So they are specialized shoe inserts that are customized to suit an individual's specific conditions and needs. They're not just the generic inserts you find at the pharmacy or supermarket. Those may offer some minor comfort, but are not really customized to address specific imbalances. I recommend that you avoid those because I think orthotics need to be customized for everyone's unique feet, and that's going to be when they're the most useful. So orthotics can be used to address current pain and dysfunction, as well as a preventive medicine to prevent against future health and comfort concerns. Orthotics typically last for 2 years, and they should be replaced as such. So if you're wearing orthotics from 5+ years ago, I would highly recommend that you get a new pair, as they will probably not be providing the same support that they once did. So here's what the orthotics that we create look like. We have partnered with a company called FootMax, which we believe creates a high quality custom milled orthotic. And in fact, FootMax orthotics are used by the NHL, NBA, MLB, national ski teams, and many other top-level athletes. And as we all know, elite athletes only accept the best, so you know for sure that FootMax products are going to be great. And as you can see in the picture here, we can design orthotics out of all types of different materials and all types of different types of footwear. So they can be made with EVA foam, leather, carbon fiber, wool, depending on what you need. And you can also get these orthotics for business, sport, everyday use, or maybe comfort, corrective support, pain prevention, shock absorption. And we can make orthotics for your running shoes, dancing shoes, high heels, whatever you're into. Your daily activities are going to be discussed during your initial assessment when you come in, so we can kind of determine which is going to be the best fit for you. And these orthotics can easily be swapped out between shoes if you do need to switch them at any point. So let's move on to how orthotics can actually help you. So I've listed on this slide some of the ways orthotics specifically help to restore your foot function, such as supporting your arches or taking pressure off the sore areas. But orthotics can be kind of thought of the same way as prescription glasses. They will not instantly cure your underlying problem, but they will allow you to function better, offer comfort, and reduce pain on a daily basis, which I think is a pretty big deal. We can also think of our feet as our body's foundation. So by properly supporting your foundation, your feet can maintain their structural balance as you stand, walk, or run, and this is going to reduce stress and strain on your joints, which will lead to less pain for you now and also in the future. And just like a house, if your foundation has a crack, it affects everything from the ground up. So this can affect your ankles, knees, hips, and your back, because everything in our body is connected, of course. So whether you do have pain in your knees, hip, or back, or no pain at all, everyone can kind of benefit from having the proper alignment that orthotics provide. So let's take a look at some of the common conditions that orthotics can help with. I've highlighted a few of the really big ones in green here. So flat arches are obviously a very widespread issue, as our arches can lose their ability to return to their normal shape, which can result in a painful imbalance. And if this occurs, your feet cannot effectively absorb shock when you're walking anymore. If this is left unaddressed, it can put a lot of stress on your joints and lead to arthritis. Plantar fasciitis, another really common one. It's that sharp pain that comes from your heel and goes into your midfoot. This can be caused by a lot of different factors, but luckily Dr. Naran can actually treat one of the very common causes, which is having overly tight calf muscles. So he can do trigger point and laser therapy to help you get pain-free, and then the orthotic is going to be something that's going to help you stay pain-free after you have that. And then lastly, as I talked about earlier, orthotics can help realign your entire body from the feet up. So if you are struggling with chronic low back pain, knee pain, other types of pain, orthotics can definitely help reduce pain in more places than just your feet. So here's a very quick picture here of just all the add-ons we can include in your orthotics to accommodate you. So if you have flat arches, we can add in an arch strip, or we can put pads under your metatarsals if you have pain there, or if you have heel pain, we can pad that area. And overall, we can make an orthotic that's just going to help ease any of your pain or discomfort, and it's going to help you with a lot of those things. Okay, moving on. So let's go over how we actually create the orthotics. So each patient that comes in receives a free comprehensive assessment so that we can identify exactly where the problems lie with your walking pattern. So in order to accurately do this, we use a state-of-the-art Metascan system, which captures your walk at 150 images per second. And it tracks the precise pressure and timing of each of the 8 key contact points of the foot. Then the computer compares that pressure to that of a normal foot, and this helps us create a perfect orthotic for your feet. So here is a quick example of what you actually have to do when you do the initial assessment with us. I'll just show you this little video. It's quite easy. You just kind of simply walk across that pad, and it captures your feet as you walk across 3 times, and then it will take an average of those 3 steps. So it's quite easy just like that, just walking like normal. Once you've done that, this is kind of the result that we see. So looking there, the red points are the highest pressure areas. So we definitely take a look and analyze where these high pressure points are. They normally should be kind of in the center of the heel and between the first and fifth metatarsals. So we have kind of a tripod of spots that we want the pressure to be located in. So this scan is really essentially helping us create the perfect orthotic for you. An interesting thing is that studies have shown that 70% of patients tested show moderate to severe abnormalities when walking, but many are completely unaware of this. So I think that it never hurts to come in and get a free scan just to be sure. After that scan is done, we would do a 3D high-tech imaging scan. So if you've ever gotten orthotics in the past, many of you may have gotten your foot physically molded. 3D scanning is a little quicker, easier, and much more effective, and it produces a better quality orthotic we have found. So here is what a completed scan will look like. So as you can see, this is a really accurate scan, and it can pick up all of the things on your feet. So it really shows how much of an arch you have. It can pick up bunions or calluses. This is my feet here, so luckily I don't have any. But it can pick up very small things like even the little moles that you have on the bottom of your feet. Like I didn't know I had a mole there, but this thing picks that up. So I think this truly helps us shape the best orthotic for you. So a couple questions then. So I'd like you now to honestly answer if any of the following sounds like you. So are you standing or walking on hard surfaces for long periods of time throughout the day? Are you participating regularly in physical activities or sports? Are you over the age of 40? Do you have any prior injuries to your knees, back, or neck? And do you have any obvious foot problems such as calluses or flat feet? And if you said yes to any of the above, then I would say to do your feet a favor and come in for an assessment. And I'm sure your feet will thank you for it later on. So now let's go on to the big question here. Will my insurance cover this? So yes, it is very often covered. So many extended plans typically offer between $350 to $500 every 2 years specifically for corrective foot orthotics. And it does help to confirm with your provider beforehand. So if you're with Blue Cross, Manulife, Great West Life, many other providers, you will typically have some kind of coverage. So all you will need to bring is a note from your GP, and we can provide you with absolutely everything else you need to get covered by your extended benefits. And we found that many of the patients that come through do not have to even pay a dime to get these high quality, life-changing orthotics. So that is awesome. Okay, and we're almost at the end here. So to make this even of an easier decision for you, we will let you try an orthotic for 6 weeks completely risk-free. And if for whatever reason you are not happy with it, you can always bring them back for a full refund. As well, you are guaranteed for 2 years against the orthotics breakdown, so you really have nothing to lose to try this out. I would say even if the orthotics only accomplish half of what I've claimed, then that feeling of being pain-free really is priceless. And orthotics can really play such a vital role in your overall health and comfort, so I think it's worth it to give it a try at least. But hurry, I do only have a very limited number of spaces each week for orthotics appointments because I want to make sure we have the time to properly analyze your feet and make the best orthotic we possibly can. So once these spots are gone, they're gone, and you may end up waiting a long time to get an appointment. And as another extra bonus here, if you do make your reservation in the next hour, then you will receive an additional 10% off your orthotics order. So I think that's a nice little incentive there as well. So if you are ready to kick your pain to the curb, just email Save My Spot to taylor@rejuvfitness.ca. Similarly, you can also text Save My Spot to my number here, 604-356-7013. And if I have any spaces left, I will get back to you and schedule a time with you shortly after. So just to wrap things up, thank you everyone for joining me tonight, and I appreciate everyone for being here, and I hope you were able to take something of value away from this presentation. I've listed all of my contact details here. If you would like to get any further information, I have my website there, or if you do want to contact me directly, I have my info there. And I also do provide rehab exercise services, so if you are interested in that, we are definitely running still. No group classes or anything currently because of the COVID situation, but I am running one-on-one sessions with people with all the proper precautions in place. So Once again, thank you for attending, everyone. I very much look forward to helping you move and feel better again. So I hope you have a good rest of the night. And yeah, feel free to text or email me if you are interested in coming in for that. That is a free assessment orthotic session if you decide to come in for that.